Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. When an egg ovulates in your body, it's called as ovulation. And what are the ovulation symptoms that your body is giving to you is the topic for today. The egg is formed and developed in the ovaries, and when it ovulates, it comes into the fallopian tubes and lasts for about 8 to 12 hours. This is the normal window, the survival period of an egg that has ovulated from the ovary. Fertilization happens in the tubes. If it is a natural conception, it happens in the tubes if sperms are present. Now, as I said, eggs last only for about 8 to 12 hours, but if you look at the sperm, the survival hours are about 72 hours, that is around approximately 3 days. If sperms are present inside the reproductive organs such as the uterus or the tubes, then fertilization occurs in the fallopian tubes. Ovulation is a complex procedure. The eggs that are supposed to be ovulating are already present in the ovaries, but the selection of the egg which is going to grow and which is going to ovulate depends on the hormones that are released from the brain, the ovaries, the whole reproductive system. Now, a lot of eggs are selected every month, but one egg grows and develops, and that is the egg which will ovulate. The rest are, it's called as atresia, the process where they degenerate. Every month this happens. A few eggs are selected, one grows, develops and ovulates. If you look at the ovaries in detail, there are some primary follicles which are sleeping, they are dormant, so you can call them as immature eggs. As they keep developing under the influence of hormones, which are follicle stimulating hormone, luteinizing hormone, estrogen, etc., they begin to grow. And as I said, a few will be selected every month, one ovulates and the rest are degenerated. So this cycle occurs every month. After it is developed, the egg then ovulates, and the follicle from which it ovulates is now called as a corpus luteum. This is a very important part inside the ovary because this is where progesterone hormone is released from. Progesterone hormone brings about the development of the uterus. It supports the embryo which may be formed after fertilization to grow, attach itself and develop into a fetus. So what are the body symptoms? What are the symptoms that your body is subtly indicating in a few women? In a few women it is quite profound. You can definitely understand that you are ovulating. Pain in abdomen is a very common symptom. That's because when the egg ovulates, it's not just the egg, there is a lot of fluid that is ovulating from the follicle. This fluid, when it lands itself in the peritoneal area, that is the abdominal area, it irritates the atmosphere over there, which causes pain. So it's a very common, rather most common symptom of ovulation. You should listen to your body and see if it's occurring every cycle when the egg is being released. The next symptom is back pain. A lot of women complain of back pain as well. You may have both symptoms, you may have only one, you may have none. So every woman is different in her physiology, therefore these symptoms also vary. Some women complain of cramps in thighs. This is also a very common issue where some women say that there is a kind of a pull, kind of a cramp in the thighs. It's also one of the symptoms. Headache could be one of the symptoms. A very important notable symptom is wetness in the cervical area. So this is because the egg has ovulated, now it's getting ready to get fertilized, and if there is a likelihood of an embryo formation, the body then tries to make the atmosphere conducive for intercourse as well. So this is a very important symptom that you could watch out for. If you are having problems in ovulation, if you have periods that are irregular and you want to understand why you are not ovulating or are you ovulating at all, so that you are able to plan your pregnancy, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.